Welcome back to the morning show here on Arise News. As anyone who works in healthcare will attest to, patient-centered care has taken center stage in discussions of quality provision of healthcare. But has the true meaning of patient-centered care become lost in the rhetoric? Joining us this morning to speak on healthcare in Nigeria, the Nigerian Medical Association Second Health Summit themed patient-centered care is the NMA President, Dr. Francis ADEDAYO, Faduyile, President, and FCT Chairman, Dr. Ekpe Phillips. Good morning, sirs, and welcome to the show.
Good morning, doctors. Good morning, doctors. Welcome to the show. Thank you for...
Good morning. How are you? It's nice to be here.
Good morning. Thank you.
I want to start by actually going into the summit and this patient-centered approach that is the theme of the summit. Can you tell people at home what that means? Because there are people sitting at home going, when they go to the hospital, they don't feel like they're the center of the care. So tell people what it is that this summit wants to address and what your plans are. Dr. Ekpe. Dr. Phillips.
Nigerian Medical Association is organizing the second National Health Summit. The first one, which held in Asaba in 2013, and we are focusing this second health summit on patient-centered care. And it is believed that the patient is at the center point of the management care in our different hospitals, and for us to be able to improve the life of patients, because a patient can be any of us, even doctors, and we must be able to look through into the patient and see how we improve the care of patient. And that is what has made Nigerian Medical Association to look at that theme for us to discuss extensively in this second National Health Summit. And the National Health Summit is a summit that comprises doctors, nurses, pharmacists, and other health care workers working in the hospital, as well as the ministry, department, and agencies of Ministry of Health and other related health institutions. For example, the Ministry of Water, because water has a lot to do with health. We have also the Ministry of Agriculture, we have education, and all other ministries that are involved, as well as the Ministry of Finance, because everything has to revolve about financing. So we are going to have a robust discussion on the patient-centered care, and we have other sub-themes that I think will also interest Nigerians.
So, Dr. Faduyile, one of the things that you'll be discussing is reversing medical tourism. That is clearly an uphill task because, as you've just said, Dr. Phillips, financing is a huge factor. How much is really dedicated to financing the health sector in Nigeria? I saw some statistics I'm going to read to you. 146 billion naira was spent on giving loans to rice farmers in the Anchor Borrowers Program in 2018, whereas the 2018 budget for health is 71 billion. For education, 61 billion. That's added together, health and education, 132 billion, which is less than what was given for rice, of all things. And then when you now factor in budget performance, which is at 55%, it wasn't even up to that dedicated to the health sector. What was budgeted, the meager amount that was budgeted, was not fully given to the health sector. So how do you plan to reverse medical tourism? We also have now border closure that the government is touting its benefits, which is great, but then our federal government officials are amongst the poster children for medical tourism. So how do we go about reversing that culture in Nigeria?
Thank you very much. If you look at it, you've just mentioned the crux of the matter. For budget for health to be such abysmally low is a big problem because it's expected from WHO recommendation that it should be 15% of the total budget. But as you can see, both education and health combined together are not even up to the budget for security. And that is a very, very huge problem. I will tell you why. The reason is that probably we have not really sat down to look at it and know that health is the most important aspect of the budget. Because even we that are talking here, if we're not healthy, we will not be here. Yes, if you look at security, it's good that we should be secured. But if the military men who are defending us are not healthy, I mean, I wonder what they're going to do. Education is the bane of everything. I mean, when a man is educated, he has solved his problem by more than half because he has information, and information is power. So the purpose of this summit is more of advocacy. We cannot force government. We can only tell government, show them the reason why they have to change the narrative, why would they have to follow the rest of the world. If you go and check United Kingdom, you can see that the topmost on the budget and the agenda is health. And if you are a politician in the UK and you are not talking about NHS, that is their national health scheme, then you have not started. So that tells you the importance of health. You know, I think that we should begin to put more budget on health, and that is the whole purpose of this national health summit. And if you look at it again, you look at reversing the medical tourism. We want to let government know that a lot of our money is scattered away, you know, to other countries, India, UK, US, Dubai, and co, you know. And these are hard currencies because our people have to change the money and go in there. Nigeria has the human resources to handle these issues. All we need is for government to give a better support and for us also discuss. We know that there is no country that can on its own fund the health care system, you know. But there are other methods, and that is why we are looking at the mandatory national health insurance scheme, which we are appealing to the president of the country to give assent, because that way every Nigerian, at least no matter how low they can be, will be entitled to basic health care. I think that is the minimum they need. And from the finance from mandatory health insurance and other that we are going to suggest during this summit, we're able to know how to finance the country's health. And at the end of the day, we're able to, I mean, those technologies that probably our people are going out to seek for, we begin to have it. If you also look at it, you see that one of the sub-themes is brain drain, brain gain. You know, we have enough Nigerians who are well in it, both within and outside the country. But by the time we have what it takes, the equipment, the finance, a lot of persons will be coming back. Remember, too, we're spending a whole lot of money. The amount used in training doctors in this country, in the UK, US, we give or take is about $300,000 to $400,000. And that is what government subsidizes here. And then eventually we have to leave because in the first place, there's not enough employment. Government is not employing much. The ratio of patient to doctor, as recommended by WHO, is 1 doctor to 600 patients. But here in Nigeria, we're looking about 1 doctor to 4,000 to 6,000 patients. So the doctors are overworked, and so you don't get the best of the doctors. So these are the reasons why we are having the National Health Summit, to actually look at the health system in this country, you know, identify the challenges, which is you can see from the sub-team, and then profile solutions. And at the end of the day, we recommend to the government of the day. Remember, in the 2013 National Health Summit, one of the benefits now is the universal health coverage we are driving towards. The National Health Act that was approved in 2014. Now there is Basic Health Care Provision Fund that is being now used to fund the primary health care, to fund NHIS, and to treat emergencies. Thank you very much.
Thank you. You actually touched on my next question, which I just want you to elaborate on. What actually would you be doing around brain drain, especially when you talk about the fact that many countries are coming here into Nigeria offering testings for doctors. I think a couple of months ago, the Saudi Ministry of Health was here to conduct exams. The British Council conducts exams on a regular basis for doctors that actually want to leave. These are constant assaults on our medical system, and doctors are leaving on a regular basis. But it's not just doctors. We have nurses leaving. We have technicians leaving. These are people that actually populate the health system. And as you look at this, as you take this holistic approach at your summit, how and what recommendations are you hoping to make at the end of this for the government to actually start to put in place something to reverse the brain drain? And once again, when people talk about brain drain, they're only talking about doctors, but it goes all the way down to technicians. I would like you to tell us about that and how this summit can help that, and any one of you can lead and add. Thank you, Dr. Francis, ADEDAYO, Faduyile, and Dr. Ekpe Phillips. Sorry, we were having some technical issues before we went on break. But before we went on break, I don't know if you heard my questions, but I'll wrap it up quickly, which is basically, how do you tackle the issue of brain drain, especially when you're looking at a holistic health approach? Because brain drain doesn't just affect doctors. I was talking about the Saudi Ministry of Health coming to poach doctors. The British Council is, they also have an exam where they've been poaching doctors. People talk about how Nigerian doctors populate the NHS. But also one of the things we need to start to talk about is also the fact that this is not just doctors, it's nurses, all the way down to technicians. We have some institutions that train some great technicians, and those people are also fleeing our shores. How does a conference like this address it? I know we have to go on a quick break again, but when we come back, I'm going to give you the floor to answer. Thank you so much for your time. Welcome back to the morning show. We're still joined in our Abuja studio by Dr. Faduyile and Dr. Phillips, who are telling us about the upcoming Nigerian Medical Association Summit. Before we went on break, we were talking about how to reverse the brain drain. I'll let you guys take it from here.
Thank you very much. As you have posited, it's not only medical doctors that are leaving the shore of this country. It is also established that nurses are living in droves. We have pharmacists, we have other health workers living. And the reasons are not far-fetched, which we have enumerated earlier. When you want to walk the talk, you must be able to put enough funding for health. And that is one of the reasons. And again, we have seen in recent time a large number of our people are living in the last few years, and it calls for concern. While we believe that it is a step in which we can use in future to improve the health of the health sector in Nigeria, the immediate effect is not good. And why are we saying that? If you look at the trajectory of India that has become a medical tourism hub, many of their medical personnel left the country, went to the developed country, gained the highly specialized knowledge, and they returned back to the country. And when they returned back to the country gave them easy accessibility to funding in such a way that they can build their super specialty institutions and hospitals. And that one returned what we call the brain drain to brain gain. But that was planned ab initio. What we have in Nigeria is just an unplanned thing that our people are just living this country, and it is an economy loss for this country. And again, I must state that sometimes in the early 60s up to the early 70s, Nigeria used to be a medical tourist hub. People as much as high as the royal family in UK actually came to the University College Hospital at those times for treatment. What has happened to us in Nigeria? And these are some of the things we want to see, that even in the bad brain drain that we are seeing, how can we convert it back to brain gain? And we now have a lot of super specialist Nigerians who have acquired those knowledge, and they are coming back, and they want to come back. That is why we all need to sit down so that we can see what we need to put in place so that we can have an environment that is conducive for them to be able to establish these highly classed medical facilities. And we need everybody, as we have said, at the summit, is not only for doctors to discuss. We have the nurses, the pharmacists, they are joining us. The ministries, departments, and agencies are joining us. Ministry of Finance is coming for them to see what we need to do to improve the health sector. And we should not forget, they say health is wealth. A healthy country is always a wealthy country. And this is the trajectory that we want to put in place at the discussion at the next at the National Health Summit that is starting tomorrow in IC's International Conference Center in Abuja.
Doctor, now I want to talk to you about improving Nigeria's health indices. We've talked about a lot of the challenges, and we have challenges in this area as well, with maternal and child health being a critical challenge to Nigeria. And also Nigeria is reportedly the #2 country in the world for people living with HIV/AIDS. What are the discussions that you're planning around this area? And of course, malaria being the biggest cause of child deaths in Nigeria.
Thank you. We are already on that road. I mean, this release of the Basic Healthcare Provision Fund is going to help, as it's been directed directly to the primary healthcare in our rural areas. Because if you look at the health indices in the urban areas are not as bad as what you see in the Western world. It gets worse as you begin to go towards the interior. And so that is why we are looking at, re-emphasizing on the need for the primary healthcare to be strengthened. It should not just be manned by maybe the community health extension workers, but well-professional, skilled people like doctors, nurses, pharmacists should man the primary healthcare such that people at those interior will be able to get appropriate diagnosis with appropriate treatment. And there will also be quick and urgent and on-time referral to prevent morbidities and mortality. These are the ways we want to change the health indices in the country. Apart from that, just like the president was talking about just now, we also, the issue of brain gain is very necessary. And that is why we're looking, if we can suggest to the government, just like you have Bank of Agriculture or Bank of Industry, if there's head bank, a doctor who have trained so much probably in the US, UK, can easily come back to the country, get a single-digit interest loan, and able to establish maybe a super specialist hospital. Also, we're also looking at public-private partnership. If you look at it together, such a doctor can also decide to partner with government. We are trying to, this National Health Summit is all about advocacy, identifying the problems and profiling solutions. And that's why you see all the sub-teams are telling you about the challenges of the country. You look at it, there's also the improvement of interprofessional relationship. Before now, you'll be hearing about strike in the health industry. But now we're trying to say, look, hey, patient is the center. Nigerian patients are worth it. When the elephants fight, the grass suffers. I'm not saying that Nigerian patients are the grass, but they are the core people in the healthcare system. So if we can resolve our differences and understand each other that we are all on the same line at different points, giving care to the patient, and then the patient get the best of benefit. We are more looking on dialoguing, being the same team, working on the patient. So if we put all this together, you find out that we will begin to gradually reverse. It's not a day's job, it's not 1 year's job, but give or take in the next 5 years, we will see the benefit of this National Health Summit. Thank you.
Thank you. Yesterday, we were talking to a doctor from the National Emergency Services, and one of the things that came up was the engagement of the environment and sanitation. And that because when you look at the environment, what's happening from a climate change perspective and the exposure to vectors that we are not normally exposed to. And also if you look at our sanitation, Nigeria, this is one of my pet peeves, which is that Nigeria is now the #1 country for open defecation. As medical doctors, when you hear news like that from the World Health Organization, what alarm bells goes off in your heads, and what cases do you know are going to be increasing? Because if you're the #1 country for open defecation, we have climate change, which causes flooding, you have drainage systems. So at this summit, how do you bring environment, sanitation, and also some of these new indices, and just having a conversation about, once again, how to improve the Human Development Index in Nigeria? Doc, I see you, Dr. Faduyile, I see you smiling a little bit, which makes me know that you have a response ready, so I'm going to go to you first.
Well, thank you very much. It's good that you are now seeing how interrelated issues that are primarily not within the health system affect the health of the populace. We talked about water, Ministry of Water, Ministry of Housing and Road. All those ministry, work and housing, all of them have direct effect on the health of the populace. And specifically, we need to say that Nigeria ranked in the last, I think it's about 5 years ago, the ranking in the world, we rank 187 out of 191 countries. And we are just a little bit higher than war-torn countries like Afghanistan and all sorts. And it is really unfortunate. Again, bringing open defecation, Nigeria becoming about the first country in open defecation is really sad. We need to do a lot of active discussion and sensitization of the populace, dumping refuse at the different drainages need concerted effort by those that are supposed to take care of that, so that people will refrain from doing such. And this is area that we want the government to put effort in. And at the National Health Summit, as we have said, we are going to have different levels of symposium, panel discussion, and the topics, as you have seen, or the theme and the sub-themes are areas that we cover this the behavior of Nigerians. And it is important for us to know also that getting toilets and disposal of our human waste are very important in curbing gastroenteritis and other form of diseases. We thank God just this year we had been certified as one of the countries that is not having the white polio again. And it's unfortunate Nigerian is...
We're so happy you're ending on a positive note as we have to go now. We wish you all the best in your advocacy work at the summit, and hopefully we'll have you back after the summit to get some outputs. Thank you so much, doctors.
Thank you so much for joining us. Thank you.